Today I'm going to read. Hi, by the way, I'm Natalie, the Good Shepherd, and I'm here to read. Look at me, I just jump right in. Today I'm here to read chapter 2, possibly chapter 3. These are shorter type chapters in this book, and so we'll see how far my flock here on my hobby farm allows me to go today. Chapter 2 for sure, Final Gifts by Maggie Callanan. This is a book on understanding the special awareness, needs, and communications of the dying. This book is written by hospice nurses and people who have shared a lot of their life with such persons who are at the final stages of their life. This is a book I've read apparently several times, and I really love when I find these books again. Do I find them? I'm not seeking them, and yet there they are, and they do seem to call out my name. Chapter 2, Nearing Death Awareness, an introduction. Final Gifts is for everyone who has been or will ever be close to someone who is dying. For families and friends, for healthcare workers, for dying people themselves. Those who are dying and those who care about them often have valuable gifts to offer one another. When someone you love is dying, you may not see gifts, but only grief, pain, and loss. However, a dying person offers enlightening information and comfort, and in return, those close at hand can help bring that person peace and recognition of life's meaning. What we term nearing death awareness is a special knowledge about, and sometimes a control over, the process of dying. Nearing death awareness reveals what dying is like and what is needed in order to die peacefully. It develops in those who are dying slowly. The attempts of dying people to describe what they are experiencing may be missed, misunderstood, or ignored because the communication is obscure, unexpected, or expressed in symbolic nature. In the final hours, days, or weeks of life, dying people often make statements or gestures that seem to make no sense. Family members or friends may say, "Her mind is wandering," or "He doesn't know what's happening now." It's not unusual for an onlooker, however well-meaning, to speak of the dying person as out of it, or losing it, or not quite right anymore. Healthcare professionals, especially doctors and nurses, may label these apparently illogical expressions as confusion or hallucination. Family, friends, and professionals frequently respond with frustration or annoyance. They may try to humor the patient, sometimes behaving as if they're dealing with a child. They may try to stop the confusion with medication. All of these responses serve only to distance dying people from those they trust, producing a sense of isolation and bewilderment. No matter what label is placed on their attempts to communicate or which responses are tried, everyone stops really listening to the dying person. There is another way. By keeping open minds and by listening carefully to dying people, we can begin to understand messages they convey through symbol or suggestion. Often we can decipher essential information, and in the deciphering, relieve a dying person's anxiety or distress. By trying to understand and therefore participate more fully in the events of dying, families and friends can gain comfort as well as important knowledge about what the experience of dying is like and what is needed to achieve a peaceful death. They can carry that new knowledge forward, finding continuing solace in it after the death of the person they loved, and as they face future deaths, including their own. By becoming more sensitive to the messages and needs of the dying, professionals can give better care and gain a greater sense of satisfaction. After many years of working with dying people and after hundreds of experiences with their special type of communication, we have identified several recurring themes. These messages fall into two categories: attempts to describe what someone is experiencing while dying, and requests for something that a person needs for a peaceful death. The experience of dying frequently includes glimpses of another world and those waiting in it. Although they provide few details, dying people speak with awe and wonder of the peace and beauty they see in this other place. They tell of talking with or sensing the presence of people whom we cannot see, perhaps people they have known and loved. They know, often without being told, that they are dying and may even tell us when their deaths will occur. Dying persons' requests are sometimes difficult to decipher. Their recognition of the importance of these needs, along with concern for family and friends, can cause the dying to control the time and circumstances of death until those needs are met. These requests often involve someone else. They may be for meetings or the healing of relationships. Such messages have a universal familiarity. For centuries, many cultures have documented aspects of dying, taking note of altered states of consciousness, mystical interludes, and deathbed visions. Literature contains many descriptions of dying people seeing visions, usually interpreted as signs of impending death. Researchers have found sharp similarities among deathbed visions in radically differing cultures and societies. Nearing death awareness often includes visions of loved ones or spiritual beings, although they don't necessarily signal death's imminence. Dying people may see and speak with religious figures. They may feel warm, peaceful, and loved. Some see a bright light or another place. Some review their lives and come to a more complete understanding of life's meaning. Realizing they are dying, they don't seem to feel fear. Rather, they express concern for those who will be left behind. In some ways, this resembles the near-death experience, a phenomenon reported by people resuscitated after being clinically dead. That is, without heartbeat, breathing, blood pressure, or other signs of life. Researchers have documented how, after being revived, such people report remarkably similar events: traveling through a tunnel, seeing a bright light, meeting deceased relatives or friends, being in the presence of a supreme being, experiencing a life review, undergoing feelings of peacefulness and relief of pain. Out-of-body experiences, in which a person travels out of the physical body, can occur in such instances, but also may happen in other situations, especially in instances of great stress. Later, such travelers may report seeing things not visible from within their physical bodies. They may recount conversations that took place far away or describe distant, even unknown places. Nearing death awareness and near-death experiences are similar, but there are important distinctions. A near-death experience happens suddenly as a result of drowning, heart attack, or traffic accident, for example, while nearing death awareness develops in people dying slowly of progressive illnesses such as cancer, AIDS, lung disease. For these people, the process of leaving this world and experiencing a new one is more gradual. Rather than being in this world one moment, gone from it the next, then jerked back to life, the dying person remains inside the body, but at the same time becomes aware of a dimension that lies beyond. Dying people apparently drift between the two. Instead of seeing their lives flash past, dying people seem to have more time to assess those lives and to determine what remains to be finished before they die. With nearing death awareness, people don't appear dead. They may undergo no visible or unusual physical change. They still have pulses and blood pressures. They continue to breathe. Most important, they continue to communicate. They may attempt to describe being in two places at once or somewhere in between. Their descriptions offer unique opportunities to enter that landscape, to participate by responding to their needs and wishes, and to learn what death is like for them, and perhaps what it will be like for us. For several reasons, onlookers often miss or misunderstand the dying person's attempts to communicate about nearing death awareness. Healthcare professionals and families may assume that what they're hearing and seeing is confusion. In medical terms, a mental state characterized by bewilderment or disorientation and inappropriate reactions to stimuli. Unfortunately, dying people are often labeled confused without adequate assessment. The truly confused patient may have dementia, an acquired, usually progressive disorder of the intellect unconnected with normal dying. The patient may be delirious, possibly as a result of fever or as a reaction to medicine. Confusion can result from a physiological condition, such as too much calcium in the blood or too little oxygen in the brain. Some of these conditions can be treated or at least controlled. In dying people, bewilderment and disorientation may stem from the unfamiliar, unexpected experiences of dying. And too often, the responses of those caring for dying people only add to that bewilderment. Family members and caregivers may dismiss what they're hearing as a dying person's dreams or memories. The dreams of the dying may contain powerful messages, especially about strong feelings. But dying people know implicitly that nearing death awareness experiences differ from dreams. Sometimes the dying person may begin to describe them by saying, "I had a dream, but it wasn't really a dream." Those who have had near-death experiences often cannot put into words what they have seen or felt. After a grave heart attack, Carl Jung said, "It is impossible to convey the beauty and intensity." A colleague of ours who had a near-death experience during a life-threatening complication following surgery had the same difficulty. "I really can't think of words that say enough," she said. "The experience was so intense. I guess infinite comes the closest word." Is our language too finite to describe such an infinite experience, we asked. "Yes," she said, "that's it." Similarly, those in the midst of nearing death awareness may lack words to describe the experience of dying, making their messages difficult to understand because they express them in symbolic language instead of straightforward descriptions. Familiar expressions, gestures, or even objects are often used as potent metaphors. By analyzing these attempts at communication in the context of someone's life, we can better understand what the person is trying to tell us. But if we don't expect such messages, we can miss them. Few of us expect a dying person to have anything new to teach. Overwhelmed by sadness or upset by the deterioration of someone they love, family and friends can overlook that person's messages. As distressing as it is to watch someone you love struggle with pain or nausea or extreme weight loss, it's harder to accept what appears to be that person's disorientation. The person seems to have become distant, a stranger. Those who categorize nearing death awareness as confusion not only miss opportunities to learn from and assist the dying, they also add to family and friends' discomfort. Professionals adept at dealing with physical problems may not be as skilled at explaining the change in a dying person's mental and emotional state. They want to be of assistance but don't know how. This can frustrate families already uncomfortable, even fearful, in the presence of someone dying. They don't know what to say, what to do, or how to act. Final Gifts, this book, offers information and suggestions to help you learn from a dying person and, in the process, understand more about the experience of dying. You needn't be a nurse or doctor or have any medical training to help a dying friend or relative. In fact, the very closeness of kinship or friendship attunes family members and friends to the symbolic language and gestures that may accompany nearing death awareness. And it's important to note that although many of the case studies in this book came from our work in hospice care, these experiences don't happen only to hospice patients. Some of those who described their experiences of nearing death awareness with us were receiving care through home health agencies, some in hospitals, some in nursing homes. Some were patients, some were friends. The issue isn't setting or type of care, but the importance of showing interest and concern, as well as willingness to listen and pay attention. In reading Final Gifts, this book, you will discover how to listen to a dying person, how to weigh gesture and meaning, so as to avoid responses that alienate and frustrate. You will see how others have approached a death in their lives in ways that have brought comfort and peace, even joy. And you will gain a peace and comfort of your own, as well as a greater awareness of the power of dying. That's chapter 2. I'm going to stop right there because my sheep have just come in and he's getting into all of my stuff over here. I have to just share again the reasons these books mean so much to me. I've been, as many of us are in life, deciphering my life all these years. And it's been most amazing to me to be able to read these books and then be able to correlate and put together the pieces of my own life puzzle and further understanding what's happened to me, Natalie. I've had NDEs, near-death experiences. I talk to angels every day of my life. I talk to God. I talk to Jesus. You know, these are things that in my life I have been labeled as, schizophrenic, bipolar, borderline personality, mental illness, such things. And yet these are all ways of my being, Natalie, that began when I was a little girl. It does take a lifetime to learn the language of heaven. And I do believe in reading these books that I continue to discover further, an awareness with understanding, which gives me further peace and joy in my life to know that what I have experienced my entire life and continue to experience now at this stage and phase of my life in my 50s is beautiful. Heaven is real. And the ways that is described in here, how when people are dying, what they see, the visions, and they speak in metaphor and in symbols and signs, these are all the ways that I talk to angels and heaven. These are all the ways that I have learned during my lifetime to be able to, like the game of charades, take the visions and everything that my inner being is receiving to be able to decipher and then share. And very much like they say in all of these books with near-death experiences and the dying, there are no words to completely, easily be able to describe what the experiences are like. I have climbed mountains in heaven. I've been asked to climb trees with a bear and an angel friend. I have seen the fields of heaven. I've seen a lot, glimpses. I've also learned that we're not allowed to hang out in heaven either when we are invited for these moments, whether they're near death or nearly dying experiences or talking to angels. These are experiences that heaven does want life to be aware of, which is why heaven does choose such individuals in life, including myself, to receive such messages. And then it is, as I've learned, heaven who helps to deliver these messages. I've loved sharing with people in life that heaven doesn't ask us to do anything. Heaven, God, Jesus, angels, Spirit of heaven, have us do life. Chapter 2, Final Gifts.